Vanakkam, good morning. In this video, we are going to discuss about the surface tension. Surface tension is the force that pull the surface molecules of the liquids in the air liquid interface is the surface tension. It is mainly occur in the inner alveolar wall. So, inner alveolar wall has the water, the inner layer is the moisture is present, that is water is thin layer of water is present. This is alveoli contains air, so air water interface is present in the water layer, that at the surface level water molecules pulls together, it create the surface tension. So mainly occur at the water air interspace. So at the level of the water air interspace, water molecules, so this is the enlarged view of the small area here. So this is the this part, this is the pulmonary epithelial cells, type 1 pneumocytes. This is the water molecules, thin layer. So the magnified view, water molecules are present. So surface tension created by the molecules, water molecule present at the water air interface. In this level only it occurs. So inside the water molecules having the force on all the sides. So it is the net is zero force. So net effect is the zero. So because the force is in all the direction. But at the water air interface, see the forces act sidewards and downwards. So this molecule, water molecule at the surface level, try to pull the water molecules. So it try to shrinkage the alveoli, and pulled it downwards. So it try to pull the inwards, and shrinkage means it will prone for the collapse of the alveoli. So surface tension is produce the collapse of the alveoli. So according to the law of Laplace, within the physiological limit, in the spherical organ like alveolus, the pressure is directly proportional to the tension of the wall and indirectly proportional to the radius. So pressure equal to 2T by R. The pressure is, the alveoli is collapsing pressure. So this is suppose you assume two alveolus is present in the lung. One is large alveoli, another one is the small alveoli. So larger alveoli having both are having the surface tension. Means equal surface tension means the smaller alveoli is more prone to collapse, because tension is equal on the both side means here radius is very less, here radius is more. So here collapsing pressure is more. So alveoli is more try to collapse compared to the larger. So smaller alveoli is collapse. So air is enter into the larger alveoli. So here again more, it will not produce adequate perfusion. Here it will not produce adequate ventilation. Okay, but what happen in the smaller alveoli, tension is decreased by surfactant produced by the alveolar type 2 alveolar epithelial cells. The larger alveoli, tension is more. So the collapsing pressure is equal on the both side. By the presence of the surfactant within the alveoli, it maintains the alveolar stability. So the increased surface tensions produce the alveolar collapse in the small alveoli. So the one alveoli is larger, another one is smaller. Means in the smaller alveoli having more prone for the collapse compared to the larger alveoli by 2T by R. Here radius is less, here radius is more. So this is also prevented by the alveolar collapse. And alveolar size is unequal. From the pressure is air is enter into the larger alveoli, so it is larger alveoli is still larger. So due to the surface tension, smaller alveoli is still smaller. So it will produce an unequal alveolar size and affect the ventilation perfusion ratio. So suppose if the capillaries here means here more air is enter here, but the ventilation is more ventilated here perfusion, but the air is less amount is transfused, less perfusion is occurred, more ventilated here, under ventilated. The small alveoli it is under ventilated. So here all the blood not carries the gas oxygen, here more ventilated. So here where still some air is present, so affect the ventilation perfusion ratio by the surface tension and edema formation. So due to the collapsing pressure, it pulls the plasma from the capillaries to the alveoli, it produces a pulmonary edema. So these are the things occur due to the increased surface tension: alveolar collapse, unequal alveolar size, affect ventilation perfusion ratio and edema formation. All these things is prevented by the surfactant. So surfactant is naturally covers the inner alveolar wall, it decreases the alveolar collapse, it equals the stabilize the alveoli and keep the ventilation perfusion ratio normal, prevent the pulmonary edema formation. So, this diagram depicts the single surfactant picture. So this is a type palmitoyl, this is a phosphate group, phosphatidyl, this is a choline. So this is the hydrophobic nature. Type palmitoyl, phosphatidyl, choline. More than 90% is the lipids in the surfactant. So it contains the apoproteins like SPA, B, C, D. Sphingomyelin protein A, B, C, apoproteins. And A and D act as the opsonine for the it product the immunity, and immunoglobulin, albumin. Okay. It is also gives the immunity. These portions are hydrophilic region. So the surfactant is normally in the air water interface, water molecules are present, means it will increases the surface tension. When the surfactant is present due to the hydrophobic region, this type palmitoyl, phosphatidyl, choline is the hydrophobic region. So it is float around the layer water, it does not go inside. So it is replace the water molecule from the surface layer, it reduces the surface tensions. So it prevents the collapse of the alveoli, it gives the product the alveolar stability and decreases the work done by the lung and prevent the pulmonary edema formation. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribe this channel, please subscribe. Thank you once again.